All right, everyone, welcome back to the industry's first conference focused exclusively on safety topics in sterile processing departments. For the past 7 years, Tom Overbey has served as the marketing director for UltraClean Systems, promoting safe cleaning practices, and he serves as an advocate for connecting the OR to the sterile processing department for maximum operational efficiency. Operating any ultrasonic cleaner can be a fairly safe proposition, but unless you follow certain safety protocols, injury can occur. This presentation is going to deliver 10 points to consider when cleaning surgical instruments using an ultrasonic cleaner. And so without further ado, I'd like to turn it over to Tom Overbey.
Hello and welcome on this fine Saturday. I hope the weather's good where you are. I want to start off first off, like what I always do, is thank everybody for all the great things that everybody does to be conscientious about patient safety. And so now with this great new Safety Burst, Safety First series here, we're extending us into an area that's basically long overdue now. And we've entered into the realm of safety, patient safety. Now it's safety for you. And we're going to expand around that safety for you aspect, as you'll see. So let's get going here. Did you know that approximately 4 million people are disabled at work every year? Now, I know this isn't necessarily industry specific to sterile processing. But think about that. We know that the number of cases for infection are, dare I say, rampant, but 4 million are disabled. Now, I don't know if that's short-term, long-term, but still that's affected someone's life, possibly permanently. And according to certain studies, that can be reduced quite a bit, at least in terms of pure incidences. So safety signage can reduce accidents by up to 80%. So what does this tell us? It tells us that there's one great big word that we've got to pay attention to, and that's communication. First and foremost, I think that if there's ever an incident that occurs, in particular, it could be related to communication or a breakdown thereof. Think about this graphic. Okay, this is what I call the continuum of care, and this is provided by Gettinga. I just love this illustration. I think it does a very good job because it talks about how we are in an infinite loop, basically, with regards to sterile processing and surgical and back again, and so on. And if there's any portion of this that breaks down, the whole system breaks down. And a lot of that I know can be directly related to safety. We hear a lot about patient safety. Let's talk about other aspects of safety as well as you and your safety. So I'd like to use a metaphor here with regards to aviation. Pilots. You've seen them if you run on your airplane, looking out the window, and you've seen the folks, the pilots, with their stripes on and their wings, and they're looking at the aircraft. They're the ones in command, and they're taking responsibility and even looking at what they would assume that is already functioning at its optimal level. Are you a pilot? Be a pilot. So let's jump on board and then consider this demo video with our flight attendant today. We're going to be talking about safety for you, equipment, and patients. Let's dial that back a second here. A lot of you fly. And if you've flown more than once, you've flown on possibly different equipment. The people in this video, although it's a mock video and maybe only one person's nodding their head, are we all guilty of this? I'm guilty of this. I don't necessarily pay attention. The oxygen masks, they're going to drop, put them on first to you and then get them to your kids. And, the safety card is the exits. Are there going to be 2 exits in the middle of the aircraft or what have you? So this is the analogy I'm trying to make here. Always being aware about things with regards to your safety. It's very important, needless to say. So Let's buckle up and let's take off here. We're going to talk about 10 things. First one's kind of biggie, and the last one's a biggie. Okay? First up, 10 things to remember, especially when working with ultrasonics. We might deviate from that just a little bit. Number one, does this PPE gear make me look a certain way? Oh my God, we shouldn't be worried about vanity and all that in the sterile processing departments, right? The thing is that you want to make sure that the gear fits properly, and it's about function. So like the airplane, like the safety card, please indulge me. We're going to look at the 2 videos that the CDC has put out. I've shortened them up as much as I can with regards to donning and doffing your gear. Now, this doesn't really necessarily talk about boots, booties, and things of that sort, and decontam, but let's watch this.
Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Put on the isolation gown. Tie all ties or snap all snaps. You may need assistance from another healthcare provider. Put on the N95 respirator. When using a respirator with a nose piece, fit it to your nose using both hands. Do not bend or tent the respirator. Extend the respirator under your chin, protecting both your mouth and nose. Pull the top strap over your head, placing it on the crown. Then pull the bottom strap over your head, placing it at the base of your neck. Lastly, perform a user seal check. Do this by using your hands to cover the surface of the respirator and gently exhale, checking that the facepiece bulges slightly. Then, while keeping your hands over the respirator, take in a quick, deep breath, checking that the facepiece collapses slightly. If air escapes through the edges, readjust the fit of your respirator and perform another user seal check. Do this each time you put the respirator on. If a respirator is not available, put on a face mask. Extend the face mask under your chin, protecting both your mouth and nose. If the mask has loops, hook them around your ears. If it has ties, secure them at the base of your neck and crown of your head. Next, put on a face shield or goggles. Lastly, put on your gloves. Pull the gloves down so that they cover the wrist of the gown. For the glove and glove technique, hinge the outside of the glove near the wrist. Peel downwards, pulling the glove inside out. With your ungloved hand, slide your finger under the wrist of your remaining glove. Again, peel downwards, turning the glove inside out. Discard the gloves. For the beaking method, pinch the outside of the glove near the wrist. Using your finger, pull the glove inside out and over the fingers and thumb to form a beak. With the beaked hand, hinge the opposite glove at the wrist and pull downwards, turning the glove inside out. With the ungloved hand, pull the beaked glove off, touching only the inside of the glove. Next, remove your gown. Untie all ties or unsnap all snaps. Some gown ties can be broken rather than untied. In that instance, break the ties gently, avoiding a forceful movement. Reach up to the shoulders and carefully pull or roll the gown down and away from the body. Dispose of the used gown. You may now exit the patient's room. Perform hand hygiene by using alcohol-based hand sanitizer or washing your hands with soap and water for at least 20 seconds. Be sure to clean your wrists where the edge of the glove was located. Carefully remove the face shield or goggles by grabbing the strap and pulling upwards and away from your head. Do not touch the front of the face shield or goggles. Next, remove and discard the respirator or face mask. If you are wearing a respirator, remove the bottom strap by grabbing only the strap and bringing it carefully over your head. Grasp the top strap and bring it carefully over your head, and then pull the respirator away from your face without touching the front of the respirator. If you are wearing a face mask, carefully untie the straps or unhook them from your ears and pull the mask away from your face without touching the front of the mask. Lastly, once again, perform hand hygiene after removing the respirator or face mask.
Thank you for indulging me with that. Now, I realized that that was intended for patient visitation, but a lot of it still applies. I know we didn't talk about boots and that sort of thing, but maybe even if there was a nuance of a reminder or of a technique, then it's beneficial. Again, always being aware. So with regards to this, you want to make sure the PPE gear is the right size, the right type, and more. You may have something that's specifically set in your, your protocol in your facility to pay attention to. But make sure that it all fits well. And then tight is one thing, but well, too tight is another. But again, it's about function, not so baggy to get caught on equipment, right? We can have it too big and actually be a hindrance and of a safety issue. We want continuity and no holes, therefore, right? So we're going to categorize this as safety for you, okay? All right, let's keep going. All right, number 2. Oh, my aching back. So one of the things that we're going to talk about is, just real briefly, like this is important, but a little bit on posture and things of that sort, but also on weight and torquing, because you don't want to overload your trays. I know you guys are pressured under time and time constraints to get batches done and get on over out to the surgery. So, but don't overload your trays. And so I know I'm being a little facetious here with this. How many different kinds of instruments can you spot in this tray here? But I think I make my point clear. And it can actually be a hindrance when you think you're trying to get work done faster, can actually put you further behind. So being methodical and conscious of your weight and your posture is one thing. Make sure to keep good, stand upright and good even distribution of tension on your back. Carry trays close to you and not extended away from your body. This is true with anything. It will help preserve the spine and make for a reduction in pain, particularly if this is something you do day in and day out. And remember, this may not necessarily apply with regards to, we're not picking trays up off the floor, but just remember, don't bend necessarily at the waist, but rather bend and lift with the knees. So we're going to rate this quick little section here, safety, well, for you. All right, let's keep going here. Number 3, did you just pinch me? So in general, ultrasonic cleaning is fairly safe, okay? Like anything else, there's always potential for hazard. So let's venture into this a little bit further with regards to operating equipment. Ultrasonic machines are ultrasonic machines are mechanical components with movable parts, there's always the chance of getting pinched or PPE gear getting caught up in a lid or other mechanical feature. So that's another one of the awareness factors that I'm trying to pinpoint here for you guys and think ever presently about. Being aware in your environment can make the difference between an effective workflow and a bad incident. So in this particular case, we're calling this safety, again, for you. Okay, moving on. Number 4, we're taking on water. So in my references, we're talking about water spillage after tray removal. There's always going to be residual water when you're lifting a machine out of a ultrasonic system, transporting it around. So maybe you give it a little shake, maybe you hold on to it another second or two as it's resting on the side of the lid of the basin to help alleviate having too much water to gather around the floor. I know you have rubber mats, but every facility might have slight variations in this, and you accumulate water and it can become a hazard. And then there's also the thing is bad water connections. I'm not asking all of you technicians and managers of sterile processing departments to do the duties of biomed engineers and technicians, but still, you're the one there working in the scenario, working in the situation, again, looking on the floor, looking around the machine. And for example, like making sure that all the connections are good. Every now and then, if you're around a machine, you happen to walking by a machine that's not snug up against the wall, make sure it snaps in nice and tight, makes a good connection or the connections are good. So wanted to show you, like in one of our installation training videos that we have, a simple aspect of doing the water connections. Now, of course, we're assuming that your systems are fully connected and operable. There are things to consider. Again, like I showed you a second ago, proper connection. There's different types of connections, but if they all are breached or weakened over time, they can certainly create a problem where water can come around. And over time, it might not happen right away, but the water can come out on the floor and all of a sudden you notice a puddle and there's a problem that's been occurring perhaps for some time or just recently. So just want to point this out to you. There is also kind of an interesting little aspect I wanted to show you here real quick, and that is how we make good connections. And that is through the use of Teflon tape. There's no adhesion layer on this tape. It's very stretchy and it becomes very thin. And you can apply this at home on your garden hoses, and everybody gets sprayed with this sort of scenario. Like I say, even at home. So you wrap this 3 or 4 times in a clockwise direction, and this makes for an awesome seal. These things can wear out over time, but I want to give you the rating of this one, safety for you and your equipment. Okay, because if your equipment's leaking, it's not working well, and it can even damage your equipment. Okay, so now, number 5, feel the power. So talking about electricity, okay, so here we have a victim that's been shocked, he's incapacitated, and we have someone coming to rescue this situation. Now, with regards to the voltages and a lot of the equipment that you have in your sterile processing department, the voltage requirement varies widely. Ultrasonic systems can sometimes take quite a bit of power and actually are hardwired into the system. But in this case here with tabletop models, they might plug directly into a wall. Okay, so, and you have lots of devices that plug into the wall, 110 volts. Or in that range, for example. In this particular case, a cable like an extension cord or a connecting cord. In the video production and filmmaking industry, they call these stingers. And now you can know why, because if you get a little bit of a connection to a 110 volt supply line, it's a stinger. It will sting you, but it's not necessarily life-threatening. There could be other circumstances to turn that into a life-threatening situation. But just good practice, good observations about your environment is a good thing to pay attention to. So let's talk about that. If you can't turn off power, try to separate the person from current by using non-conductive objects such as a wooden or plastic broom-handled chair or rubber doormat. Okay, so these are the extreme situations here where, instinctively you would come in and you would want to just turn the power off. That may be safe to do. Okay, so just wanted to, point that out to you. But this applies to most any situation. Then if you stand something dry or non-conductive, such as a dry newspaper, or stack of newspapers, a telephone book, or wooden board, anything, just grab anything. Time is of the essence. It doesn't really matter what you use as long as it's something that you know it's non-conductive. And then, unplug an appliance. If plug is undamaged or shut off, the power via circuit breaker, the fuse box, or outside switch. So this one is going to be a big safety for you and your equipment, because the thing about it is, if your electrical cable connection is not plugged in great or sufficiently seated and connected firmly in the back of your machine or wherever it's connected, can become dislodged, water can drip in there, and anything can happen. It can get heated up and start melting the plastic. So making sure that your equipment is also safe with proper connections, remaining well connected, is a thing to keep in mind. Okay, so good safety for you and your equipment. Okay, moving along. Number 6, don't look, don't breathe. So what are we going to talk about here? A couple of things, right? A couple of vital organ sets, eyes and lungs. Okay, the effects of detergents in your eyes is instantaneous, and this can apply to many other chemicals as well. Okay, here's a situation where we know that in this video, we have some tabletop ultrasonic systems where you're actually applying a detergent manually. There are many other systems with much higher throughput that have dosing systems. Okay. But the thing about this is, and as a reminder back, PPE, of course, is critical, okay? But freak accidents do occur. That's a fact. And do you instinctively know where your eye wash station is? This applies to anything chemical related. It doesn't necessarily apply to just ultrasonics. Consider these actions. Have drills to get your eye wash station. Now, I don't mean toppling over trays and people trying to get to an eye wash station as a practice or in real life, okay? But maybe have a buddy system. Upon yelling a code word, practice taking your partner to the eye wash station. After all, how can a victim get to the eye wash station if they can't see because they've, induced some bad chemical in their eyes? Establish a specific eye wash protocol, which you may have, but also practice using it. Then there's the other aspect of the vital organ called the lungs, and we have aerosolization. And that is somewhat specific to ultrasonic systems because we have cavitation energy occurring, and tiny bubbles can create tiny little atmospheric mist at or around the level of the basin and emit these bioburden hazardous particles into the air. That's not a good thing. So the big thing about working with ultrasonics is make sure that when you're doing your processes, that you keep the lid closed. Very simple and done, taken care of, okay? So you can even see the safety first sticker on this video. And make sure don't operate the equipment unless the lid is closed. So some machines won't operate unless there's already the tray has been inserted into the basin and lowered through some lift mechanism. But still, pay attention to aerosolization in any aspect in your sterile processing department. This one, yes, and undoubtedly is a big safety for you, okay? Look, Ma, no hands. Okay, although it's seemingly safe with working with ultrasonic systems, the energy that's put out by these systems, any system, not just these, is the fact is that the cavitation energy is set for within a range to clean safely surgical instruments without destroying them or damaging them. Because in the case of this image right here, and pointing out to you, I'll say this first, although seemingly safe, that the ultrasonic energy has been shown to cause skin irritation and joint and ligament loss. But in the case of this image, we're talking about much higher cavitation power. You can see on the left, this is a mechanical part, split screen. On the left, it's old, paint's been rusted off. And on the right, it's been heavily treated with industrial strength ultrasonic cavitation. So in most part, it really doesn't, the cavitation energy in ultrasonic machines that you use in your facility isn't that bad, shall I say. But there's this graphic that I use in a presentation that we use to demonstrate frequency and power in cavitation. This particular graphic was dealing with power. And on the high end of power, like I showed you in the mechanical part, over time, with using stronger cavitation, can actually shorten the life of your instruments. It can dull sharp edges and things of that sort. So this is, of course, over time with regards to your instruments. So, but in general, just keep your hands out of the ultrasonic during the cavitation process. And again, this might particularly more readily apply in tabletop systems. So that's a big safety for you. All right. So got an itch? What are we talking about? Well, things that are corrosive, chemicals in general, non-enzymatic detergents. There's the alkaline and the acidic, corrosive at a pH at greater than 9 and a corrosive pH at less than 4. Okay, so you get any of this stuff on you, you definitely get an itch. And of course, we already talked about chemicals in the eyes and eye wash station. This is something that you should know that pH, what is pH? P stands for potens, P-O-T-E-N-Z, meaning power. And with regards to H, it's hydrogen, and meaning inferring the greater or lesser amounts of hydrogen ions. We're talking at extreme ends, of course, with ultrasonic cleaning. Usually it's a neutral pH, somewhere around the range of 7 or so. So point here is that high-low pH detergents are reserved for tough applications like car washers. Okay, so you are working with them, but are typically used also in the life sciences sector. But they can be hazardous for both you and your instruments. So keep this in mind. Again, be aware. Enzymatic detergents are typically recommended, like I said, for ultrasonic cleaning. So we're going to rate this one as safety for you and for equipment. Using too many corrosive chemicals and too much power can be detriment to your instrumentation and perhaps your equipment too. Number 9, ouch. What are we talking about? Dangerous, life-threatening instruments are hiding in your tray. Okay, so we know you're always working with, forceps, all kinds of sharp devices in sterile processing. It's a hazardous situation, no matter which way you look. In decontam, sharps, of course, should already be separated. Freak accidents do occur, with finding needles and these sorts of things in wire mesh trays. But just to be safe, don't just grab big batches of instruments, but rather pull them from the top and work your way into the tray. Or if you, as you're doing to your pre-cleaning, getting ready to ultrasonically clean, just don't treat them, shall I say, haphazardly. Have a method if you sort of gently, turn the tray over and lay the instruments on the field that you're working in, with or in front of you. Just be not too fast and not use too much force when you're grabbing instruments, when you're getting a hold of them per se. So this one, we're going to rate safety for you, right? Okay. Number 10. It's the last one, but it's a big one. It's a dirty job, but somebody's got to do it. Okay. So we've had instances where we've had people send pictures to us with instruments with bioburden clearly visible on them. And that's just not a very good thing. You saw the picture that's up here. This was presented to us. How come this is coming clean? Well, an ultrasonic machine does great things. It does great work. All of them do. And the thing is, but you need to work for it so it does its work for you. Instruments should be free of visible bioburden before cleaning ultrasonically. Okay, I think that's a given. Now it's a little pop quiz. Okay, so you can answer this in your mind. You can answer it out loud. Or if you wanted to chat the answer, there's two instruments here, one on the left and one on the right. Which one is free of residual protein? And if you want to hum or sing the tune to Jeopardy right now, feel free. But I'm not gonna touch that one. But I'd like you to think in your mind which one is the clean one and which one's the dirty one. Okay, because we know we can't sterilize dirt. Okay, so once upon a time, checking a machine called the Pro Reveal, the instrument on the left has 24.6 micrograms of protein, 0 on the right. Okay, I think that's kind of significant because you can't necessarily ascertain that an instrument that looks clean is actually clean. So be aware of that too. So we're going to continue on with extending that safety element to our patients in this regard. Visual observation, though, is very critical. Let's apply this conversation to the realm of detergent a little bit here. Make sure that your detergent is also properly plumbed, and this is through a variety of means. We saw earlier where we were dosing the detergent manually, and this is now for a system that we're going to feed our detergent through a pumping system, okay? And so we want to make sure that we have good connections and they're tight, that there is detergent in the supply container and that the detergent has not expired. So in this particular case here, this is a situation where we have had people call us and our instruments aren't necessarily coming clean, come to find out that there was not enough detergent to get actual suction into the machine, or they were running without having any detergent in their machine, sometimes for up to even 2 weeks. So, that's a big ugh. Okay, so, but again, make sure that you have detergent, it's connected, and then it's not expired. Now, talking detergent in your processes, rinse and repeat. Well, if you have a ophthalmic system and you're cleaning it and you've got residual detergent, we've gotten rid of the bioburden. Now it's the detergent that's the issue, particularly with the aspect of avoiding TAST, toxic anterior segment syndrome. That we know is it's common occurrence if you're not flushing your detergents out properly. All right, so I wanted to point that out to you. So now I'm not advocating selling you another machine. Let me state that very firmly. We are in the business of selling ultrasonic machines, of course. So there are also a lot of other manufacturers. Amy has indicated that if you do ophthalmic instruments, they recommend a separate isolated machine for doing just that. So just want to make that point clear. And also, we need to think about water a little bit because that's our biggest resource. We rely heavily on water. And there's a TIR, Technical Information document out there for us that helps us to respect our water. There's a quote in there. This is an Amy document, TIR 34, right? This is a quote, 3.3.1.a. The instrument malfunction because of salt or other water deposits could result in breakage inside the patient, or mechanical movement could be obstructed by residual debris because of inadequate cleaning from inactivation of the detergent by poor water quality. So if you're not continuously turning over your water in your storage bins and things of this, your storage containers, these storage containers can be a harbinger for bacteria. And we know that's a big safety issue for patients. So this is a very good resource to keep in mind for safety in general. Now, I want to do a little sidebar real quick here. We haven't really mentioned much in the way of IFUs, and interestingly enough, I can't think of many presentations where we don't mention anything about IFUs. So on the left here, we have OneSource. We know about OneSource, and they recently did a major site overhaul, and that's wonderful. Okay, they've expanded their capabilities. They have a massive database, and have actually now rendered a faster response time. They're easier to navigate. So if you haven't visited OneSource in a while, I recommend that you do so. Now, on the other side, flip side, we had a presentation earlier today by Petrus, Sterilization Intelligence. This is a fantastic aspect to have in play along with OneSource. There's plenty of space for both, but this is a new thing that's coming around. This system, it's a system. It considers multiple IFUs in a tray. And, fancy that. It's something that's been needed for a long time. And it helps to track your cleaning processes. And it uses artificial intelligence. And let me say artificial intelligence is no more than a massive database of facts and decision-making data that can allow a machine to make a determination. And there's artificial intelligence systems now actually that are out there that actually will render to you why it made the decision that it did. And look at what's going on in radiology, and has been for some time with artificial intelligence, making decisions on pinpointing breast tumors much better than, say, radiologists can. We're not eliminating radiologists. It's a work together, side-by-side scenario or tool to keep in mind. But this is a great system that's coming on board here, and it can assist in cleaning multiple trays simultaneously. So it also increases your efficiency working in the sterilization arena. Process challenge devices. Make sure you have cavitation in your system. Okay, so there are many different process challenge devices. This just happens to be the one that we use, and we recommend it in our systems. But it's a soil sample that's deposited on a coupon or some substrate, and we want to get it clean. And the reason is, of course, is we want to know the cavitation is working. The foil test also shows that cavitation is working. Inside your basin, you can put a piece of foil in there, run a cycle, and you can see the pitting in this example. It's easy for record keeping and really very inexpensive. Preventive maintenance, filters and screens. That's also an important aspect. And you want to make sure and change your filters because it can accrue massive amounts of bioburden. It can block up and prevent your machine from working and actually not getting your systems, your instruments clean. So we recommend that you stay on top of that. There is also inside your machine, further in the machine or elsewhere, maybe attached in the back somewhere, perhaps another filtration system. This is our drain screen here. This can also collect bioburden. So we want to make sure that biomed's on top of the schedule with this cleaning aspect. And if you notice your machine's not really cleaning well, this can be an easy fix. We also ask that you do refer to your, technical manuals, or certainly biomed does too. With regards to disinfection, quick point here. This shows a manual application of disinfectant in your basin. Of course, you want to pay attention to what you're doing again with safety in mind as you administer this, and also as you clean and wipe down the basin at whatever schedule you should be doing your disinfection with. And this big one, big number 10, we're giving it everything. Safety for you, your equipment, and your patients. Okay, so caution can never really be overly abundant. And, you can't talk too much about it. You can't be overly cautious. Let's talk a little bit about these things in review. So PPE gear worn properly with good fit, size, and placement. Eye wash stations, think of the instinctive aspect with eye wash stations. I've got something in my eye. I immediately need to know and get to my eye wash station. I mentioned earlier, perhaps a buddy system or some protocol, and practice it. Keep ultrasonic cleaners and other machines closed during operations, and visually inspect. Be aware of your surroundings. Communicate. Very important. All these together, we're going to do some good. Follow the preventive maintenance schedule and keep the machine in top operating performance. Make sure your detergent is flowing through your systems. Are you out of detergent? Be sure to check the expiration dates, and check for cavitation with PCDs, process challenge devices. Keep your machine clean. and follow all of the IFUs all the time. So as our metaphor plays out here, you've got your checklist. You're a good pilot now, right? We know what we need to check, our surroundings, communicate, look around, check our machines, make sure we've got good PPE gear on. And this now can apply to one more checklist item. You as now pilots, as you've earned your wings, safety starts with awareness. Stay alert and always be aware of your surroundings. We've completed our journey. Thank you so much. Remember, just be safe. Okay, so if you have any questions, I want to say thank you all to everybody for listening to this. I thank Beyond Clean very much for allowing me to come on and give you some information. Hopefully you'll find it useful. There's my email address if you have any questions, any links of any things that I can, documents safety-wise, anything that I've covered, or perhaps I didn't cover sufficiently. I'll be happy to help you out. So with that in mind, again, thank you so much, and I'll turn it over to Lindsay.
All right, Tom, thank you so much. Something that I want to just point out is, since we live in more of a virtual education environment right now, as is 2020, thank you for making a presentation that felt very interactive and in person. I think there's a lot of opportunity to use these digital platforms, these virtual event platforms, to facilitate engagement and facilitate conversation in new and different ways. So Tom, thanks for such great information, demonstrations. We did get a lot of great questions that came in. So I am just going to dive right in. The first one says, let's see, my hospital has an ultra clean system that has a 2-bay setup. Can resin molded trays be used in the ultrasonic machine? Because we use trays that have holes in them.
Yes, you can use wire mesh trays inside your system. Of course, obviously, if they fit in there and can stack appropriately, that's not a problem, and that won't go against any IFU. As long as the perforations, I believe, is a standard mesh weave at about a 0.5 centimeter spacing in them. And of course, you're not doing lumens at this point. The whole big thing about trays in machines, the capabilities that ultrasonics bring is cleaning lumens. So the connectivity of those lumens in the tray and the connectivity of the tray itself into the system is very important. So you have, as long as it fits in there appropriately, you're good to go. And then, of course, then the hose needs to fit and snap snugly into the basin itself. So hopefully that answers your question. Again, you have my email if you have any further questions on that question or any other questions that I may get. Anything else? Yes.
So you mentioned wire mesh. What about molded resin based trays?
Oh, I'm sorry. I missed that.
That's okay.
Molded resin is not very good for ultrasonic cavitation. Things like rubber mats, and thank you for the clarity on that, Lindsay.
Sure.
Anything that's not stainless necessarily is not going to resonate well. Ultrasonic is dealing with sound waves, very high-pitched sound waves. And, if you put something over your mouth, you're going to baffle that sound, okay, that's transmitting from my mouth to your ears. Okay, analogously inside of an ultrasonic basin, you have sound waves going through water, not air necessarily. And that medium, that material absorbs that sound like muffling. You don't get the clarity, the full sense of what I'm saying. So that's not necessarily going to be provide very good efficacy for ultrasonic cleaning. Sorry for the misunderstanding.
No, that's great. I think it was a great segue into that clarification. What do you do when your ultrasonic never passes a TOSI test, but managers don't seem concerned?
Say that again, please.
Sure. The question states, what do you do when your ultrasonic never passes a TOSI test, but managers don't seem concerned?
Well, I would first check with Biomed and make sure that you're getting cavitation, like I recommended a foil test inside there. Our machines, we've recommended the wash checks for quite some time. And that's what we do. I know certain manufacturers have certain TOSI tests or other challenge devices by other manufacturers that they use. The fact that and so that could rely on detergent issues. However, it's not, whatever device it is, it's not coming clean and showing efficacy of cavitation. It could be detergent. Detergents are designed to work with enhancing cavitation. Okay, so it could be detergent. I don't want to say necessarily the type of detergent, but it could be expired. It could run out. If that's not the case, then you might consider the water aspect. Like I mentioned in TIR 34, was there a season change? We're now starting to change seasons, and we do get calls from people that all of a sudden, first cold day, we are showing a reduced efficacy of cleaning. What is it? So the water municipalities have changed their water source. And so that affects you. Hard water is horrible about, reducing the efficacy of ultrasonic cleaning. So I would check your water, check your detergents, check your fittings, make sure your detergent's working. But I would be concerned about the managers not paying attention to that very signal that something might not be working. And you may need to address that maybe a little further up the chain or get people to rally in with you to help ascertain that, we need to be making sure that this very test that we have is proving that our ultrasonic machine is working. Again, you can feel free to, reach out to me. I'll punch the email address back up again if this needs to be treated on an as-per-case basis.
Okay. Let's see. Comment came in. I really enjoyed this presentation. Appreciate the interaction. This question says, what kind of stuff would you recommend to disinfect the machine itself?
Well, that's going to determine on what you want to do, what you decide. We don't advocate any specific disinfectant for it. We feel that all the disinfectants that are out there, if they're properly indicated for ultrasonic cleaning, that you can use them. We do not, mandate any specific disinfectant. So that's pretty much fair game. And then, of course, following the IFU for that disinfectant. So, and I'm not going to make any name claim or anything of that sort. Now, if you want to contact me, I can, help to provide you some information, perhaps for some disinfectants that may be more suitable for ultrasonic cleaning, but I'm not here to state any specific. We don't make a disinfectant for that. And I know it's a very harsh chemical to deal with, so we've left it up for some of the other major medical equipment chemical manufacturers to distribute those for your systems. But again, feel free to reach out to me on that. I'll punch this up again.
Okay, wonderful. This one actually, a couple of questions came in about the PPE demonstration that was given toward the beginning of your presentation. This one says, we aren't allowed to discard our respirator mask. How would we place the mask in a paper bag that is supplied to us? Would it be in a similar fashion to how it was discarded in the video?
Well, I just want to say that whatever you're doing in your department, that video again was more specific to patient visitation that's put out by the CDC. And what you have in your department is perfectly fine. Again, making sure that you've got the good barriers between you and whatever bioburden are not sterile situation you're working with. So I don't have any problem with the way you were doing it. It's just that video was intended more for, patient visitation, and that's by the CDC. So, you may have your own protocol. Like I said earlier, you might have your own way of doing things, but as long as you have the policy in place and then you use a quality quality systems approach to make sure that you're doing the same thing over and over again correctly, shouldn't have any problem. I hope that answers your question.
Okay. This next question says, what instruments made can be put in ultrasonic machines? Is there a rule of thumb, or do we check manufacturers' IFUs for this information?
Well, that is a good question. And yes, it's all relevant. Very good question. Okay, so basically metallic, non-motorized, non-electrical instruments are absolutely, indicated for cleaning in ultrasonic systems. So this is titanium, typically titanium and mostly stainless steel. No problems at all. And they resonate well with ultrasonic energy. Because they're metal and because of the chemical constituents, the molecular makeup of stainless just works really well with regards to how that sound energy permeates through the basin. And it's high frequency vibrations. It's actually kind of helping it to eliminate, eradicate, remove the bioburden from the instrument. But things like drills, absolutely, that's a no-no. It's like, imagine, can you put your phone in the bathtub? Well, nowadays you probably can for a little bit, but it's not going to do well. So that's not necessarily a great example, but things that you use as tools that are electrical in nature, do not do that. Things like electrical cords that have rubber insulation, like I mentioned, stainless resonates well with ultrasonic cavitation energy, but the rubber absorbs it. So you're probably not going to get your insulated cords and things of that sort cleaned. Plastics, rubber items, they're not going to do well.
Okay. Are there different grades of stainless steel that hold up better to the cavitation process than others?
Oh, well, also, yes. I want to go back to the other thing, following IFUs. IFUs, you're just open to making sure that, you're following good protocol in terms of, ultrasonic cleaning. So I just wanted to, point out there was that comment about IFUs. Okay, so our next question was what?
Yes. Are there different grades of stainless steel that stand up better to cavitation than others?
Right. Okay, yeah, the grades of stainless steel, thank you, in the 300, 400 range, it doesn't really matter. Don't be concerned about that. It's considered stainless. It fits well within the frequency range, the power range that your ultrasonic systems will provide you. So I wouldn't worry too much about that. I wouldn't go deep diving into IFUs, specifying what instrument is going to be what stainless steel grade or number. There are lots of them. Personally, I'm not concerned with that, and I don't think you should be either.
Okay. When the process of cavitation is performed with the lid closed in the U.S., how can a technician get loss from it?
When the lid is closed, how can the technician what?
Get loss from it?
Get lost from it?
I think it's speaking, I'll ask for clarification on that specific one. If the person who entered that question can provide a little bit more clarification, that would be wonderful. One thing that a couple people wrote in about is the the shoe covers or boots not being a part of the PPE portion. And I know you spoke to that when you mentioned that demonstration was more for patient care settings. But do you want to speak to the use of shoe covers or boots at all in decontamination when you're working with ultrasonics, when you're working with decontaminating items?
Right. Well, you just want to make sure you put your boot covers on and that they're the right fit, first off, that they're the right size, because you could put something on that's too big, or you could try to force yourself into something that's too small. On the something that's too small, then you're going to, reduce your circulation and you're going to get tired, and that's not going to be very good. And something too big can allow for, cavitation to enter into the field. So you just want to make sure that you've got your boots properly on with your PPE gear, inserted into the boot, so you have good closure, just like you would have a glove. The glove needs to be over the wrist. And so you want to make sure, and that's a good question too.
All right. Wonderful. Tom, that is the questions that came in. There are a couple of folks who wrote in saying that they would be interested in knowing more about what disinfectants are typically used for ultrasonic machines. Are there any are there any high-level details or is there any high-level information that you can provide to give any guidance toward that, or do you prefer that folks just contact you directly?
Yeah, just contact me individually, because there might be specific nuances to an individual department. So I want to be able to address that directly, and I appreciate that, and I will follow up.
Okay, wonderful. Well, everyone, that concludes session 3 of the Safety Burst conference. Thank you so much, Tom, for an outstanding discussion on ultrasonic cavitation safety to protect instrumentation, technicians, and our patients. If you decide later on this weekend or next week that you have additional questions on this topic, Tom's contact information shown on the screen can also be found in the speaker bio tool on your screen. All of these sessions will be available on demand. So you can come back to them, you can share them with your colleagues, you can reference them. The beauty of a virtual event is it can live on. So we want to make sure that this information, this education stays available to you. Between the last couple of sessions, we shortened your breaks, but you're going to get a little bit of an extended break between this one. As a reminder, there will be a 15-minute break before the next session. We are glad you're here. Grab some water, grab a snack, and we'll see you all in the next session. Thank you so much, and thank you, Tom, for a great presentation.
Thank you. Thank you, everybody.